Good morning. We shall talk about the topic of early menarche today. And what I mean by menarche is the age at which a young girl has her first period. When we talk about early menarche, it is, during the age of, in general, menarche happens between 8 and 13. So when we talk about early menarche, it's in the lower of that range. Um, However, there's another aspect to that, and that's precocious puberty, wherein the age is under 8 years. So the girl attains her puberty, including all the physical changes as well as the first period, before the age of 8 years. And that is something that we need to look into more carefully. I will talk about early menarche first and then go into the precocious puberty aspect. Um, History-wise, when you look at history, in say 1800s, the age of menarche in Europe was something like 17 years. And over the years, the age of menarche has come down slowly. And nowadays in India, anywhere between 8 to 13 years is considered a normal time for a menarche. Um, the girls are tending to have their first period a few months before when their mother had their first period. So it's all coming down, and the contributors seem to be various causes, but the common ones seem to be overweight and obesity, and also use of animal protein or increased consumption of animal protein in their diet, and also additional chemicals and pollutants in the diet as well as the atmosphere. And what I mean by chemicals and pollutants particularly is the BPA, which is the plastic, the BPA in the plastic, which infuses into the food from the container that the food is in, as well as phthalates. And phthalates are there both in the diet, such as animal dairy products, etc., and high fatty foods, as well as in plastics and cosmetics of various kinds. So we really don't know what it is, but the age of menarche seems to be coming down further and further. If a parent has a daughter who has reached a menarche at 8, 9 years of age, certainly they tend to worry about it. And why they would be worried is, I think, quite reasonable to think. It does have some implications on their health, such as having a shorter stature than what their potential would be, and a slight increase in the risk of breast cancer. And also, girls of 8, 9, 10 years, or even 7, 8, 9 years, are not psychologically mature to handle the first period. So other than that, most of the times they just need reassurance and a little bit of counselling, and they can handle themselves quite well. In general, the ways to prevent early menarche is to encourage good eating habits right from the beginning, and that's completely a parental responsibility. So increasing whole plant foods, whole fiber foods, reducing dairy products, reducing animal protein in the diet, not eating out too much, avoiding plastic containers, and avoiding too many cosmetics, etc. I think would go a long way in reducing the chances of having an early menarche, as well as keeping their weight down. So once they get into the overweight or the obese range, the fat in the body, under the skin as well as inside, tends to cause some hormonal imbalances which can induce an early menarche. I think when we talk about precocious puberty, that is when the girl attains puberty even before the age of 8. And that has quite a few causes which have to be evaluated. So it can be either a central cause, which is in the brain, like a brain tumor or a hormonal, excessive production of gonadotropins, or a peripheral cause, that is like an ovarian tumor or obesity itself. So that will need to be evaluated thoroughly by a pediatric endocrinologist. I hope I've been able to answer your questions. Thank you.